Team Singapore. We'll wait for you would be knowing, or else we get an extra team.
If to Hatta declare if Singapore team does not turn up, then there is an opportunity for.
Let's wait for 2 minutes. Otherwise, we'll do it. We're changing to that side, the laptop. This also.
You need the contact, right?
Nirmal. All the best. All the best to you too. Okay. Yeah. All the best. All the best. Chalega, no issue. All the best. Yep. All the best to you guys. Take care and all the best. You can see there also. I mean, okay. We'll try and adjust this thing. Okay. Screen? Okay. Yeah, I'll come. कल बोला था 2 LCD लगाए. चार्जिंग चाहिए. So we're waiting for Team Singapore to join.
Yes, definitely. Please fill it. Just say default. Yes.
Sorry. The AV wale want AV person.
Should be open to anybody else who wants to.
Yeah. So since Team Singapore doesn't seem to be here, are there any other people who would like to volunteer to become another team? Yeah. So those who want, they can join for the quiz as one extra team, the extempo team. We call them Team Extempo.
How much is the price?
And there is a prize of 1,000 USD, right?
Okay, we have some participants.
So we have 2 participants. Okay. So, audio chalat nahi. Audio. Yeah, outside. We need 2 LED screens here for each people. 2 LED screens if possible.
Muslims are not feeling happy there.
Will
So we just tell them India seniors.
Yeah. It's okay. Oh, okay. It's okay.
India 1, India 2 kara lage.
That's okay. Yeah.
Huh?
Yeah.
Junior, senior.
So we have 2 Indian teams. The winners of barbecue, they are all residents, so we call them all are residents. So we call them India Junior. And there's a team of Indian people who are, I believe, all are consultant. So the India Senior. So there are 2 teams from India: India Junior, India Senior. Okay.
And I will talk to the Singapore government to give you honorary citizenship since you're representing Singapore.
So 4 of you can go to Singapore anytime. Now make sure that you're seeing the screens properly. All of you, screens. In Japan, can you see the screen properly?
You can't hear us. Okay, can you hear me now? What about the offer that I gave to the Indian team to become Singapore citizens? Did you hear that? You heard that? Okay, good. Okay, so then it's all clear. So we'll speak loud and clear.
Am I audible now? Yeah. So Team Japan, can you see the AV properly? Okay. Everyone is comfortable with the audio visual? You can hear us properly? You can see the screen properly?
Okay, we'll do test.
We are going to do it. Yeah.
So let's go through Japan first. So Japan, audio visual, okay? Okay, can we test your mic? Can we test your mic?
Say something, tell your names. Hello. You can tell your names.
Test your mic, please.
Hello, I'm
Okay, what about your buzzer? Could you test your buzzer?
Buzzer? Great.
Okay, so you have to press and keep your hand there for a while. Bless the buzzer, then you will buzzer, then you will respond. Okay, next team is Malaysia.
Names? Testing, 1, 2, 3.
Well done.
Great.
Well done.
Fantastic.
Next team is
Team Sri Lanka?
Sri Lanka.
Sri Lanka.
Well done.
Okay, buzzer please. Buzzer please. Oh, great.
Okay. And then we have a
combined team from Middle East, Team Iran and Team
Middle East, North Africa.
Okay, Team Iran and Team UAE. Okay.
Unity in Middle East.
Yeah. Buzzer. Buzzer. Buzzer hard.
Okay. We have discovered a problem, not unusual in the Middle East. So
buzzer. Yeah. Great.
Let's try it again.
Okay.
Okay, everyone try. Can you try? Dr. Fahmi, can you try also? Well
okay.
Done. Okay. Okay, then we have the honorary Singapore citizens.
Yeah. The senior Indians. Mike, please. Use the mic. Say something. Hello. Yeah. Brother, please.
So in Singapore, every time you say hello, you must say la. Hello la. So please say hello la.
So you will be called either Team India Senior or Team Singapore. The words would be used interchangeably. Okay? During the quiz.
Okay.
Right.
Buzzer is okay?
Yeah.
Buzzer is okay.
Team Thailand. Hello.
Sawadee. It's quite soft.
Hello.
Okay. And then we come to
Team India, the winners of barbecue yesterday.
Yes, the junior team who's...
yeah. Use your mic.
It's fine. Okay. All right. So we better introduce ourselves.
Yeah. I'm Dr. Rahul Kulkarni. I'm from Pune, India.
I'm Umabadi. I'm from Singapore, and I've got no responsibility for the absence today. I must make a disclosure. Okay.
So it's going to be 4 rounds actually, not 3 rounds. And each round will have different sets of questions. In first round, the question will be asked to each team, and it will pass to the next team only to the one team. So from Japan, it will pass to Malaysia. From Malaysia, it will pass to next team, etc. So only it will pass to once. Second round onwards, it's all going to be buzzer. All right? And the points will be different for each round. We'll tell you the point scoring system at each round, which is going to be different. And the quiz master decision is going to be final.
Okay, at this point, I want to make a point that regardless of race, religion, or language, for the next half hour, the 2 of us are God.
So is the demigods.
Okay, we are God. So we decide the answer. Specifically for the cases that I'm going to show, I must make a disclosure that many of the patients that I'm showing are real patients that I've seen, mostly in underserved regions, which means I have not confirmed the diagnosis with any sophisticated test. So if you happen to disagree with my diagnosis, please come and tell me, but privately after the quiz. Okay, do not cause confusion on the podium. Okay, and then the last point is that, again, because these are real patients and they have kindly agreed to be videoed, so please respect the privacy of the patients. If you're taking pictures, as medical professionals, you all are completely aware of what are the rules of medical confidentiality, what are the ethical rules in terms of distributing patient information, and the same for people who are watching on Facebook and YouTube. Please respect the privacy of these patients who are very kind to be videoed. With that, I think,
yeah.
Okay, there is some kind of a commotion going on among our among our
So,
participants.
yeah. So we start with round one. I'll just tell you the rules. It's going to be one question per team. The team that answers it correctly gets plus 100. If you don't answer correctly, you get minus 50. It's going to be an MCQ, so there are going to be multiple choices there. If you don't answer it, the question passes to the next team. The next team gets plus 50 or minus 50 if they answer incorrectly. The question stops there. It doesn't go to third team. If you don't answer, probably we have lots of people in audience wise enough to answer all these things. And the quiz master decision is going to be final.
Okay, 60 seconds.
I'm coming to that. 60 seconds per question. So you have ample of time. Take your time. Answer properly.
Okay. So don't worry. We are very fair individuals. Remember, we are God. So we'll be very fair. So even if there's a problem with the buzzer, or some other issues, technical, we will make sure that the spirit of the competition is respected. So do not be anxious, and all the best to you.
Sit back, relax, and enjoy the quiz.
May the best woman win.
Yep.
Usually it's the women who win, so that's why I say that.
So we have a sample question. This is just to test, right? So it's like that. We show an MR, and then we ask a question. This is a sample question. What is this? Is it a Chiari malformation? Is it a Dandy-Walker malformation? Is it spontaneous intracranial hypotension? Is it basilar invagination, or it's Lermez-Duclos syndrome? So got it? So we are going to ask you questions, simple questions like this. So don't worry, relax. All right? Shall we start the quiz? So let's start. Okay. Okay. So question number one, we start from team Japan. Okay. So this is a 27-year-old male. He had epilepsy since last 10 years. He had a poor scholastic performance, and he has a long-standing skin disease, a skin lesion that he has. So now I'll show you some photographs of this person. This is the skin of this person. This is a T2 MRI of this person. This is a T1 MRI of this person. The GRE is being shown here, the GRE image of the MRI. And then we also have a CT scan of the patient here.
The timer is not going, is it? Is the timer moving?
No, the timer would start now.
Okay.
All right. So what is the diagnosis? Is it neurofibromatosis type 1? Is it lipoid proteinosis? Is it Rain syndrome? Is it CTX, or it's Marden-Walker syndrome? Team Japan. Do you have the answer?
The answer is D.
Lipoid proteinosis, plus 100. So this is lipoid proteinosis. This is an entity which is a neurocutaneous syndrome where there's a deposition of both lipids as well as proteins. It's an autosomal recessive condition, and classically it is diagnosed by doing a CT, which would show curvilinear or coma-shaped lesions near the medial temporal lobe, and there's a typically calcification of the amygdala, hippocampi, and the parahippocampal gyrus. Well done.
Okay. Question 2. What drug treatment is reasonable? Now, this is a question for the Malaysians, my neighbors. What drug treatment is reasonable for these young patients with progressive weakness, wasting of the limbs and tongue, bilateral facial weakness, possible autosomal recessive family history, and sensory neural deafness? So this is the video showing the progressive motor neuron disorder, autosomal recessive history, and the video is playing. Facial weakness, severe bilateral sensory neural deafness, fasciculations. Okay, and now the timer will start. The timer should start now. Okay, the choices are there: rituximab, diflunisal, riboflavin, salbutamol, or riluzole.
We choose D, salbutamol.
Minus 50.
Okay, so now
The question goes to next team.
the next team that it happens to be the
Sri
Sri
Lanka.
Lankans pressing the buzzer.
Yeah.
Riboflavin.
Absolutely
Riboflavin.
correct.
Plus 50 to Sri Lanka.
So these
What is the condition? What's the condition called?
no extra points, huh?
No extra points. Just name the condition.
Madras Motor Notice. Brown bag.
Okay. So again, these are two patients that I saw in Pakistan and Myanmar. I have not confirmed the genetic diagnosis, but I thought was reasonable based on clinical features to start them or riboflavin. Remember the dosing and remember the classic clinical features. Okay. Thank you.
Okay. So third question again goes to Team Sri Lanka. So this is a 65-year-old male. He presented, the history is a bit longish, so please listen to it carefully. He had 2 days history of febrile illness, followed by encephalopathy. He had a past history of left trigeminal neuralgia, for which he had undergone microvascular decompression surgery about 9 months ago, and now he was pain-free from the disease. This patient underwent a lumbar puncture, and the cerebrospinal fluid examination showed proteins of 250 milligrams percent, glucose was 20 milligram percent, and there were 367 cells, of which 75% were neutrophils. And this is an MRI of the person, the T1 weighted image, and that's a T2 weighted image. So this patient was treated with ceftriaxone, vancomycin, and ampicillin. However, in 10 days, there was no improvement. He continued worsening. His fever worsened. His drowsiness and encephalopathy kept worsening. And the lumbar puncture was repeated after 10 days, which showed proteins of 135 milligram percent, glucose of 31 milligram percent, and the cells were 90% neutrophils, a total of 320 cells. So the question is, what is the likely cause of this illness? Is it resistant bacterial meningitis? Is it tubercular meningitis? Is it fungal meningitis? Is it malignant meningitis? Or it's a chemical meningitis? Team Sri Lanka. Yeah. Any answer? You want to pass?
Pass, some other team will take it.
Next team.
We pass.
Okay. So next team is team Iran and Singapore, team Iran and Dubai combined.
Okay. Actually, we make a slight modification. We think it's fairer. We'll just count to 3. Whoever presses the buzzer first will be allowed to answer, will be given the second choice, okay, to answer this question since Sri Lanka passed it. So 1, 2, 3.
Tubercular.
Tubercular, minus 50. Anyone from the audience? So this entity is called as persistent neutrophilic meningitis. If you have a bacterial meningitis, the CSF is almost always going to become lymphocyte after you treat it, whatever is the response. Here you see that the CSF has remained neutrophilic. So the entity is called as persistent neutrophilic meningitis. This is a disease where even after 1 week of antibiotic therapy, if the CSF remains neutrophilic with persistence of signs, it is called as persistent neutrophilic meningitis. And the most common organism which causes this are fungi or rarely atypical organisms like nocardia. And indeed, our patient had actinomycosis, aspergillosis. So this is aspergillus meningitis that this patient had. Yeah.
Okay. So the next team is
Team Middle East.
team
Middle East.
Middle East, right? Yes, team Middle East. Okay. So this young man has progressive limb weakness. What is the diagnosis? Can we start the timer? The choices are there to read. Please start the timer, yes.
It's like ABCD and ABCD.
Pass.
Bas. So anyone who wants to answer, you can press buzzer 1, 2, 3.
LGMD 2B, sir.
Oh, wait, we'll do it again. It's okay.
LGMD?
We'll do it again. No, wait, Rahul, because I think there was some misunderstanding. So let's do it again. I'll count to 3. 1, 2, 3. Whoever presses the buzzer fastest will be given the choice, the second choice to answer this question that has been passed over by the Middle East team. Okay, wait for my count. 1, 2, 3.
Dyspalinopathy, LGMD2B, sir.
Okay, so the two of us have decided that that's the right answer, and the point system for
Point system plus 50 to the ex-Singaporean team or the Indian team senior.
it's okay, guys. As I said, this is just a competition in the interest of love and friendship and brotherhood.
Spirit of neurology.
Yes, in the spirit of neurology. There will be small issues here and there. So please, the
Don't
gods,
worry.
the gods are also,
Yeah.
the gods are
Yes.
not infallible.
Yes.
Okay.
You want to show something?
Okay.
Yes.
So now I'll just quickly go through. As you know, this signs are beautifully described by Dr. Sunil from India. So the calf head on a trophy sign and the diamond in the muscle sign, right? So this again is a patient I saw in Ghana who have not confirmed by biopsy or genetics, but thanks to this beautiful papers from Dr. Sunil, we were able to make a clinical diagnosis on this patient. Okay. Thank you.
So next question is Team 5, the Team India. So this is a lady with 1 year history. She had difficulty in walking. She had occasional falls. She had a progressive deafness, and there was no cognitive impairment in this lady. And then I'll show you her MRIs. We have an MRI of her brain, which is T1, T2, and spine. You want to see the images again? We have a T1, we have a T2, and then we have a spine. All right. So what's the diagnosis? Is it spontaneous intracranial hypotension? Is it superficial siderosis of the central nervous system? Is it spinocerebellar ataxia type 3? Is it dural AV fistula, or it's a syndrome called CAPOS? Team India. Yes.
Yeah, superficial siderosis. B.
Superficial siderosis. Okay. Plus 100.
Okay. I think,
Yeah. So this is indeed superficial siderosis, and the hint here is, of course, the deafness. It's a disease which will always start with deafness. So it's a deafness with ataxia. That's how the disease would start. Of course, they may get lots of other things. And if you see the MRI carefully, there is a good coating on the cerebellum as well as on the pons in this patient. Interestingly, many of these patients actually have an intraspinal collection, which can be having multiple names, something like what we see in people who are having spontaneous intracranial hypotension. Similar collection also sometimes is seen in people who are suffering from siderosis. And it is believed that this is a source from which the bleeding starts. It is from there that there is this micro bleeding which continues, and it goes on the top and covers the entire area of the brain. And that's how the patient develops this syndrome.
okay. So I think this is not a rapid fire round. So I think just to keep the rules consistent from the beginning, if the first team passes, one of us will count 1, 2, and 3. Then the teams will press. And whoever presses the buzzer fastest after the count of 3 will get the chance. Okay? Because this is not a rapid fire round. So now this is another patient that I saw.
Team Thailand.
Okay. So this is Team Thailand, right? So it's a young lady who's got retroviral disease. Now there are 2 parts to the question, but the point system will be the same. You'll still get the same points.
So they get 50-50.
Yes.
So there are two parts in this question. Remember that there are 2 parts in this question. You answer first, you get 50. You answer second, you get 50.
Okay.
All right.
Not to worry. Okay. So she has got retroviral disease, but unfortunately she's not well treated. She has got a history of substance abuse, including alcohol. She is homeless, and she was admitted actually to my ward in Zambia for acute altered mental state and unsteady gait.
You want to see the video again? Video. Go back.
Okay, so the first question is, after you've seen the eyes, what would you like to examine?
Pupils, palate, VOR, fundus, ankle reflex. No, this is not a buzzer round. This is a question which will be answered by Team Thailand. So wait, no buzzer.
Thailand. Okay, you go. You want to
You want to
try?
answer?
Your answer is D, the palette.
Correct?
Correct.
Absolutely
Plus
correct.
50. Why?
You have got a second part to it.
Why? Why do you say palette? Why do you say palette? Why you want to see the palette?
I want to examine the palatal tremor. That's the symptomatic palatal myoclonus.
Okay, that's
Ask-
right. Correct.
Ask and you shall be given. So this is the palatal exam. But interestingly, the palatal exam was normal. So correctly, Thailand thought about the most common cause of pendular nystagmus, which is oculopalatal tremor. But this lady did not have an oculopalatal tremor. So the second part of your question for your full marks would be, a mental state improved somewhat after starting IV thiamine. So she was able to give us further history. And she told us that she takes something else besides alcohol. What is that something else?
Is it glue? Is it marijuana? Is it cocaine? It's amphetamine? It's LSD. So you answer this, you get plus 50 here.
So remember the other teams, just hold your horses. I'll be giving you a chance by counting to 3.
So our answer would be A, glue or toluene.
Absolutely right.
Plus 50. Great. So they get plus 100. Very nice.
So this patient has got acute pendular, well, not acute, subacute pendular nystagmus. And because she's been substance abusing, she's been abusing various inhalants, including glue and petroleum products. Thank you.
Great. So the last question of round 1 goes to Team India. So this was a 72-year-old lady. She had presented with 10 days history of headache and confusional state. She had a past history of right temporal hemorrhage 3 years ago, and she was on sodium valproate at that time. She had a history of hypertension as well. And that's the MRI of the lady. This is a diffusion weighted MRI. This is the flare MRI. This is a sequence which is called as MIP. And then we have a contrast MRI, contrast T1 MRI. Would you like to see the MRIs again? So 10 days history of encephalopathy with headache in an old lady who had past history of right temporal hemorrhage and hypertension on sodium valproate. So diffusion, flare, MIP, and contrast T1. So the question is, what is it? Is it autoimmune encephalitis? Is it amyloid angiopathy? Is it CNS lymphoma? Is it CNS vasculitis? Or it's a dural AV fistula?
We appreciate the audience.
Audience remaining calm and not shouting hard.
Not shouting out the
Yes.
answers.
Girish is raising his hand.
B, amyloid angiopathy.
Plus 100. What is this entity called? What is this entity called? There's no points for this.
Scary, sir.
This is called carry, yes. So amyloid angiopathy can have 4 presentations. It can present with recurrent hemorrhages, which can be lobar, or there can be cortical SH. It can present with dementia.
Inflammation.
It can
Cerebral amyloid angiopathy related inflammation.
Yeah, it can present with dementia, it can present with transient deficits, and it can present with CARI. And this patient had this CARI, which you correctly said, so you get plus 100. CARI is a disease which is accompanied by inflammation and edema. It's a treatable disease. Remember, it's a type of amyloid angiopathy which is treatable. It presents with subacute encephalopathy, headaches, and sometimes seizures. MRI would show similar lesions, a lesion which is showing vasogenic edema with some enhancement and associated microhemorrhages elsewhere in the brain. And it's a treatable disease. It can be sometimes treated by giving steroids. So the answer is correct. This is CARI. So we finish the round 1. At the end of the round 1, can we have scores? Can we have projection of the scores? So Team Japan 100, Team Malaysia minus 50, Team Sri Lanka 50, Team Singapore and India India Senior 100, Thailand and India Junior 100. So we go to round 2.
Okay, pay attention, round 2.
Round 2 is going to be different. Now the questions are not going to buzz. It's all buzzer. There are no 60 seconds, 30 seconds. It's all buzzer. Okay. So the rules are first set fingers first. Anyone who presses the buzzer first is going to answer. So we are going to see who is the person who is going to press the buzzer. And as you press the buzzer, you have to answer, because you can't press buzzer and wait for some time. Okay. Then the question will be null and invalid. If you answer correctly, plus 100. If you answer incorrectly, minus 50. If you don't answer, the question again goes to next person. We again give 3 to 1. The one who presses the buzzer again will answer plus 50, minus 50. Okay. If a team answers before the choices are shown, then you can get plus 200. But you can get minus 100 if you don't answer correctly. All right. The quiz master decision is going to be final. Okay.
Can I pass after pressing the buzzer?
Can I?
Can I
No,
pass?
no, I think that
You
would be
can't
incorrect.
pass. That's incorrect. All right.
Okay. So
we are going to see
so
from
a few minor points. Okay, minor but important points. So being gods, we will, one of us who's reading the question, the other person is watching the buzzer. So of course, as you know, gods have many eyes and many heads and many arms. So we will make sure that we will see the right buzzer, but our decision is final.
You have a chance to get 200 points also if you answer before the choices are shown, but the choices can be tricky. Just show an example. You saw this case that I showed you as a sample question, right? I showed you this case but as a sample question. Now you can jump and say that this is Chiari malformation, but the question can be different. And the question here actually that I wanted to ask is, what was the person who described this disease? Was he a neurologist? Was he a neurosurgeon? Was he a pathologist? Was he a radiologist? Was he a physician? So the question can be different. So you can press the buzzer, but you can be ready to get minus 100 also. So anyone knows who was this person? Anyone knows who was this person? This was described by Hans Chiari, and he was a pathologist. This was an era when there were no neurologists. It was all pathologists. There were no radiologists at that time also. He also described Budd-Chiari syndrome.
Choice that. One more thing. So if let's say the first team gets it wrong, okay?
Yeah,
Then-
we said 3 to 1 again.
Yeah, one of us will count 1, 2, 3,
3 to
and
1.
then 3, 2, 1,
Yeah.
1.
Okay.
So far we've been counting.
Okay.
So the gods disagree. So 1, 2, 3. Okay. At the count of 1, 2, 3. So second time around, don't jump the gun. Wait for us. Give you 1, 2, 3, and then we will decide. Okay.
You all are ready? One person can press buzzer per team. Not 2 people or 3 people can jump on the buzzer. Don't jump on the buzzer, please.
Okay.
If there is an issue, someone who has got very high eyes. So UMS, you can tell us who is the person who has pressed the buzzer first. If there is a dispute, UMS. Mr. President.
Mr. President, decide.
Okay. All right. So your question.
My question.
Yeah.
Okay. Okay. These patients have subacute progressive limb weakness.
You pressed? You pressed the buzzer?
Yes.
So answer the question. You know the question? There's no question in this. So please answer. You have to answer now. You have pressed the buzzer. So you need to answer now.
As you can see,
Please answer.
there was a
Huh? Please answer.
You have to answer the question.
The question can be anything. There's no
Otherwise
question
you
in
get
this.
minus
Do you see
point.
any question there? There's no question. So please answer. Now you press. You have a chance to answer.
Okay, you can't take too long.
Yeah, because you press buzzer, you have to answer. So
No.
we are not asked question.
Okay.
We are going on.
Okay.
Still you press the buzzer.
Okay, so we have to minus points from you guys. Sorry. I think we made that.
We mentioned the rules. We mentioned it in the rules.
Sir, we didn't know that question will not be
Please
asked.
pay attention.
See the rule. If the team presses buzzer before the choices are shown, they get plus 200. But if they don't answer correctly, they get minus 100.
And
We are written there. It's amply clear.
It's
Sir,
amply
we
clear.
didn't know that, sir.
Are it is written there. I showed it 30 seconds before.
Okay, so no, it's okay. Let's not. No. Okay, no.
Minus 100.
Okay,
Minus-
so now, okay, no more. Okay.
Sir, we'll
So let
attempt
me-
the answer.
Okay, the demigods, the gods are getting a bit
You want to-
upset. Any further discontent from the contestants, there will be minus points for dishonorable behavior. Okay, we will follow rugby rules.
Yes.
Sir, we'll
Okay.
answer. We'll
Rugby rules. So no more further points of because it is delaying everybody.
Yeah.
Okay, so we will
Sir.
not take any appeals. This is not football. This is rugby.
Sir.
Okay,
Okay.
let's go on.
Dermatomyositis.
Minus 100. Minus 100. Okay. So you
Okay,
can ask the question.
thank you for trying, but that's not the right answer. So now I will put out the question. As the slide comes out, whoever presses the buzzer.
You have a
first-
chance to press again.
Okay, you.
I'll look at who's the one who's pressing the buzzer.
Okay, whoever presses the buzzer first will answer. Okay, and of course the first team is allowed to retry again. Retry. Okay. What would you like to examine next? Apex beat, the abdomen for hepatosplenomegaly.
So Team Thailand.
Our answer is C, lung auscultation.
Well done.
Well done. Plus 100.
So again, this was a case I saw very, very close to you in Vietnam. This man, we auscultated his lungs and we found there were N-inspiratory crepitations, which made us suspect that this patient probably has the anti-Jo1 related antisynthetase syndrome. So again, clinical diagnosis, I'm afraid I don't have a confirmation,
So-
but thank you for agreeing.
So we have a technical problem with the team Sri Lanka. Actually, they were the ones who were trying to press the buzzer first, but it didn't go.
Okay. So who's speaking? Who's speaking? Who was
The buzzer is
person?
pressing for everyone, no? Team
Okay.
Sri Lanka, try and press your buzzer, please.
So it didn't work initially. That was a problem.
Yes, it didn't.
You have to press it hard.
Okay, let's test the buzzers again. Okay. Team Middle East, can you test your button?
Buzzer.
Buzzer. Okay. Team Japan?
Test your buzzer, please.
Not working.
No, no.
It's working.
Okay, let's start again.
Team Malaysia.
Okay, Malaysia. Okay, Middle East.
Yeah.
Okay.
India.
But doesn't work every time.
Well,
So if first person presses the buzzer, the other buzzers automatically are off. So
Okay.
okay. Then who else is testing? Thailand, can you test again? Can you test your buzzer, Thailand, please? Okay, and Team India, please. Team India. Okay, Team India senior.
they pressed it.
Pressed. Okay, good.
Okay.
Okay.
So can we go to the next question? So Team Thailand gets plus 100. No, Team India gets plus 100. Team Thailand gets plus 100.
Okay, so Sri Lanka, your buzzer is okay?
Press hard. Okay.
Okay, okay.
So
So
next question.
remember the rules, guys. Remember.
Anyone wants to press buzzer? Okay. So now I am going to ask the question. Please see who is the one who is pressing the buzzer. What is the eye movement abnormality in this patient? Central vestibular nystagmus.
Thailand.
Team Thailand.
We have to stop the question and.
Team Thailand.
Number 4, downbeat nystagmus.
Minus 100. Sorry, minus 50. It's minus 50. Minus 50. Sorry. So other teams get a chance.
At the count of 3.
We count at 3, 1, 2, 3. Then you get a chance. Wait. Wait. You say.
Okay, I'll say. Okay, I'll say it at my normal tone. 1, 2, 3.
Team Malaysia.
Number 2, upbeat nystagmus.
Upbeat nystagmus plus 50. So indeed, the lady had an upbeat nystagmus. So we know that upbeat nystagmus can occur if there is a lesion in the caudal medulla. The lesion, the pathways for upbeat nystagmus goes from the central superior vestibular nucleus through a structure which is called as ventral tegmental tract towards the superior rectus nucleus, and that keeps the eyes up. And if there's a lesion anywhere in this, the eyes will go down, and then there is a corrective drift up that causes the upbeat nystagmus. Same time, there is also a pathway which goes from the superior vestibular nucleus to the caudal medulla, and from where it again goes to the superior vestibular nucleus. So you can get upbeat nystagmus if you have lesions at two sites, either at ventral tegmental tract in pons or caudal medulla in lower part of medulla. So like what our patient had. Indeed, this girl was a patient who was a patient of malignancy. She was on treatment for a long period and she suffered from Wernicke's encephalopathy, and she had this lesion leading to upbeat nystagmus. This is a lesion in this area which is called a nuclear intercalactus.
Nice case.
Yeah. Okay. All right.
Okay. Question 3, I will read it and Dr. Rahul will be looking at the buzzers.
Yeah.
Okay. What LGMD is best associated with this histological appearance?
Who pressed? Team India Senior?
You have to answer quickly. You can't just, if you delay too long, the gods will decide that you've been belligerent.
2C.
Minus 50. Again, the other teams get a chance. We say 1, 2, 3.
1, 2, 3.
Team Malaysia?
B, LGMD 2B.
Minus 50. The answer is LGMD 2A. It's a carpino. Yeah, your choice.
So, so this is a lobulated fibers. It's described in many other conditions, but classically seen in calpainopathy.
So 2 teams get minus 50. All right. Next question. I would show you a photograph of a book. This is a book which is called as The Diving Bell and the Butterfly.
This is about locked-in syndrome, diving bell and butterfly.
Plus 200.
And the story is like he was a gentleman who used to work in a magazine. He got accident and then he was locked in the state. He was blinking only one eye. With that blink, he used to write a novel. That novel was reflected in the cinema.
Plus 200. The novel also came up as a movie. And the question, of course, you answered it correctly. So this was a person who was a French person. The original book was a French book, which was later converted in English. And there was a movie also. And he blinked only his left eye. Okay, if you would have said left, I would have given you 300. Okay, it took him 10 months to write the book. And then one word usually used to take 2 minutes for him to blink and write a word. So great. So next person, this is a young boy who presented with single seizure and acute encephalopathy. This is a diffusion MRI of this boy. You see the ADC, the same person, corresponding ADCs are there. This is a T2 and a flare and a GRE and a contrast. So would anyone like to answer here? Okay, so I show you the choices. The one who knows can press the buzzer. So what's the likely cause? Is it heroin? Is it drugs? Is it press? Is it carbon monoxide? Team Iran and Dubai. Minus 50.
Okay, so I will count to 3. 1.
Wait. Reset the buzzers. He is going to say 1, 2, 3. So go ahead.
1, 2,
Carbon
3.
monoxide.
Oh, that's not correct, right? So we already said the rules is to wait for me to count, and I've been counting consistently at the same pace, right? So we will have to disqualify the team from participating in this answer, and we allow the other teams to answer this question. So team India Senior will not be allowed to participate in this.
So we say 1, 2, 3 again. Anyone who knows the answer, except these 2 teams can answer, say 1, 2, 3.
Okay, so 1, 2, 3.
No answers? Audience? Drugs. Which drug? Which drug? Name the drug. So that's 5-fluorouracil. Okay. So this is a 5-fluorouracil induced encephalopathy, and the MRI shows lesions which are diffusion restricted and they are not seen on T2 or flare, and they are usually reversible. And indeed, in this patient, everything reversed after a period of 3 months. These are lesions which are seen only on diffusion, and it reversed completely.
Okay, so this is my question again. Again, it's a real patient, so please forgive my poor cinematography. So the video is not the best. Okay. This lady complains of left-sided ptosis and diplopia on looking up. You'll see the eye movements in a while. So I need to tell you the left eye, there's elevation restriction. Left eye elevation restriction because of my poor cinematography. The question is coming up now, so you can watch the buzzers.
Yeah, the question is coming up now.
What is the localization?
Team Sri Lanka,
Superior division third nerve.
Well done.
plus 100.
So, as you can see, she had a restriction of elevation, lid ptosis, and normal pupils. That's classic of superior division of the third nerve. Thank you.
Okay. So next question. This is a middle-aged male who had 3 days history of headache, followed by 3 episodes of seizures. He had a past history of systemic lupus erythematosus with nephritis. He was on mycophenolate, steroids, and hydroxychloroquine. He had a past history of tuberculosis 6 years ago. I'll show you his images as well as one of the photograph. Would anyone like to answer here? All right. The question is, what is the diagnosis?
Okay, Thailand.
Thailand,
C, no cardiosis.
plus 100. So this is nocardiosis. These are weakly acid-fast organisms, which are branching filaments, and they can also be seen on KOH. So this is nocardiosis. So this patient had nocardiosis. It is seen with immunocompromised people, more so with steroid use and organ transplant than with HIV. And the CNS involvement would usually come with brain abscess, which are often multiple. So we are at the end of round 2. We'll just take one question for audience to make sure that the audience also is awake. Anyone from the audience can shout.
Dr. Rahul will give iPhone as a prize.
All right. iPhone 25. All right. This is the audience question, which will come up. Okay, so anyone from the audience can answer this. I am going to show an MRI of a person who does not have cryptococcuses.
Because that was my diagnosis when you showed me the
Yep.
slide.
Moya. Great. So this is Moya disease.
So iPhone 25.
So you'll get iPhone 25 once it comes to India. Yes.
I'm witness here.
Yeah.
The
So
gods don't lie.
we are at the end of round 2. Can we have the scores? Right. So the scores are Team Thailand leading with 250, Team India Junior is 200, and Sri Lanka is 150. Team Japan is at 100. Team India Senior is 50, and rest other teams are minus 50. So buck up, guys.
Okay, round 3 is fine.
So we go to round 3.
Okay, so I think the temperature of the room is going up, so it's time for us to calm down and think about some artistry in neurology.
But it's going to be a fire. It's going to be a rapid fire. We are going to show you questions where there are no MCQs. You just have to answer. It's again going to be fastest finger first. The team that answers first gets plus 100. Incorrect answer gets minus 50. The next team again gets plus 50 and minus 50. And always keep reading the line which is written in red. The quiz master, this is going to be final.
So you watch, okay?
Yeah.
You watch that.
So we start
Okay.
the question. You can press buzzer anytime as the question is put up.
So I would like to thank Dr. Fertitta for his for allowing us to use some of his work. So identify the neuroanatomical structure. Living in the ponds, I work to keep you safe and alert. First name for my blue melanin, I help produce adrenaline. Who am I?
Team Thailand,
Locus ceruleus.
plus 100. That's local ceruleus.
So for the rest of us mortals, okay, the ceruleus is supposed to represent the color of sea in Latin. So, so that's what locus ceruleus, the spot of blueness in the ponds.
Question 2.
Identify again the neuroanatomical structure. We come as a group, not as one. Name for the midline seam we run. Most active when out bright is the sun. We help to modulate 5-HT1.
Team India. Minus 50.
Okay, now the second team will get a chance.
Any other team?
One.
I say 1, 2, and 3. Team Thailand.
Raphe nuclei.
Plus 50.
Well done.
Well done. So, this Raphe nucleus.
So I think that's quite obvious from the description now that Thailand has told us what it is. Okay.
Question 3.
Descendants in the Latin bridge, and of the seventh son, on way to pass the hammer by, engaged till dinner done. Identify the structure.
The structure.
iPhone 50 for you. We got it.
Yeah. Anyone?
Okay, we'll open to the
All
audience.
right. Audience. Loud. Wait. You please. Okay.
We feel it is facial nerve and hammered, so hook up hammered and
Name the anatomical structure.
What?
Name the anatomical structure. Name the
branch of
neuroanatomical
facial nerve,
structure.
facial nerve nuclei.
Name the anatomical structure. You will want to say facial nerve nucleus?
Remember, it's a descendant in the
Yeah,
Latin
you
bridge,
pressed it.
and of the seventh
that
son.
facial nerve exit from the stylomus after.
What is your final
Just
answer?
name the structure. That's it.
What is the final answer? You are answering 4 questions. So answer just one. 4 of you. Just one. You press the buzzer. You can't take so much time.
Sir, cardia tympan.
Plus 50.
Well done.
Or plus 100? We give them plus 100?
Full answer.
Plus 100.
Full
Plus,
answer.
we give
Full
them plus
answer.
100. It's chorda tympani.
Okay,
Plus
so
100.
descendants in the Latin bridge. Okay, Latin bridge is supposed to be the Latin name for pons, and of course the seventh son because the seventh cranial nerve. And as the team beautifully illustrated, they are passing by between the anchors and the malleolus, malleus, not malleolus,
And
malleus,
engage till the dinner is done.
and then till the dinner is done. Okay, so I've been borrowing from Dr. Fattidar's book, so I thought I should not be so shameless. So the last one is a poem that I wrote some time ago. So what disease am I describing in this poem? Boundaries apparently regimented, walls, border posts, customs, man and material separated. Yet GBS, a resident of the PNS, spotted dallying in the CNS. Somnolence, Babinski, Bell's, SIADH are the guises he uses in his forays. What disease?
Team India. Plus 100.
Thank you.
So that's because of encephalitis. So we are at the end of round 3. Can we have the scores? So Thailand 400, India 300, Sri Lanka 150, Japan 50, India senior 100, and Iran, Middle East and Malaysia minus 50. So we are going to the last round, which is going to be round 4. Okay. See the rules again carefully. Again, it's going to be fastest finger first. We are not going to give any options, so you need to answer properly. If the team that answers, presses the buzzer first and answers properly, gets 150 points here. So big number of points. All right. If you answer incorrectly, you get minus 50. Next team can again get plus 100 and minus 50. And if the team answers before the question is asked, you get plus 200, but minus 100 for an incorrect answer. And again, the quiz master going to be the final demigods here. So I'll show you again the sample question that I showed you. I showed you the sample question of this person, right? And you can jump on the buzzer and say that this is Kiari, but the question can be something else. The question is, what was the nationality of the person? So the question can be any question. So be sure when you press the buzzer. Anyone knows the nationality of the person? He was an Austrian person. All right. See the rules again. There should not be any confusion. All right. If you press the buzzer before the question is asked, you have to answer. Plus 200 for correct, minus 100 for incorrect. Is that clear? All right. Let's start. All right. So we start. This is a book written by a neurosurgeon, which was a best-selling book. Name the neurological disease that the neurosurgeon who wrote the book was suffering from. No takers? Yes. This was the bestseller book from New York Times. It is written by a neurosurgeon. It's called Neurosurgeon Journey. So, no takers. Question is gone. Anyone from the audience? Meningitis. So, this person suffered from E. coli meningitis, a rare kind of meningitis, and he was in comatose stage at that time. He was on ventilator, and he thinks that when he was in comatose state, he was in heaven. So, he wrote a book which is called as Proof of Heaven. And the book describes his experience in the comatose state. You have to answer now. Please answer. You press the button. Please answer. Beaver sign minus 100. Sorry, minus 50. Oh, sorry, minus 100. We are not shown the question. So minus 100.
Okay, so now I'll give the rest of the question.
Name the site on the chromosome abnormality in these patients.
9.
We'll do it again. Wait, for both of you, we'll do it again. So we say 1, 2, 3. You can press the buzzer. Wait. Don't press the buzzer. Wait. Okay. It's fastest finger first. You can say 1, 2, 3.
Okay. Apparently my 1, 2, 3 is much more
Yeah.
calm and 1, 2, 3.
So Team India Junior.
So this is D4Z4, chromosome number 4. And D4Z4 will go low. DUX4 will go high. Seen in FSHD.
Plus 150.
So just to engage the audience, I just quickly show this basis of why do we have a Beaver sign. So in this particular case, this is a patient. So in Myanmar, you can see that his upper abdominal muscles are very much intact, but his lower abdominal muscles are completely dystrophic. So that's the reason why, you get a Beaver sign when he does a crunch, the umbilicus goes up. And the reason it does that is because the upper abdominal muscles are very much intact, while the lower abdominal muscles are very dystrophic in this particular condition. And this was also demonstrated by a fortuitous scan that the patient had, which shows the intact upper abdominal muscles, but the dystrophic and atrophic lower abdominal muscles. This is to wake the audience up.
All right. Next question. This is an HIV positive person who was on therapy. CD4 count was 335. He presented with 2 weeks history of encephalopathy, left-sided paresis, and seizures. This is a CT scan of the person. And then we did a CSF in this person, and the diagnosis came up from the CSF. That's the CSF. So what's the diagnosis? Team India?
Strongyloids.
Plus 150. So that's strongyloid stercoralis infection, which is an intestinal nematode. It would go to brain if a person has what is called a hyperinfection syndrome. This infection occurs when the organism crosses the abdomen, the intestinal wall, and goes in the systemic circulation. And in the brain, we get meningitis or meningoencephalitis like this patient. Usually, this would be seen in people who are immunocompromised. So this patient had strongyloides stercoralis hyperinfection syndrome, plus 150.
So the next question, a middle-aged male with frontotemporal dementia. What is the diagnosis?
That's it. Team Thailand,
Spontaneous intracranial hypotension.
plus 150.
Well done. So for people who are poor at radiology like me, the arrow sign is very useful. So the arrow sign points to the pachymeningeal thickening, the sagging brainstem, and the tonsillar herniation. And I'm told that the pituitary gland looks more prominent than it should by my radiologist, although I can't see it. Okay, so this is the behavioral variant of frontotemporal dementia mimicked by a treatable cause of spontaneous intracranial hypotension.
So this is a 40-year-old female. She presented with acute right-sided hemiparesis, and I would run you the images of this lady. You can stop me anytime and answer anytime. All right. This is a diffusion weighted MRI of the lady. That's the flare of the lady. This is a T2 image in the lady. There is a T1 image which is seen. This is the angio of the person. And then she also underwent lumbar puncture, where the CSF showed proteins of 103 milligrams, glucose of 76 milligrams, and cells were 88, 70% of those were lymphocytes. So can you tell the diagnosis? You want to run me the slides again, images? Team Dubai and Iran.
Chemical meningitis,
Sorry,
rupture cyst, chemical meningitis from rupture cyst,
chemical meningitis from
epidermoid cyst, the dermoid cyst.
plus 150. So she had suffered from left MCA infarct, secondary to vasospasm, which occurred secondary to chemical meningitis because of a rupture of a prepontine epidermal cyst, epidermoid cyst. So this was a prepontine epidermoid cyst. Yeah. So this plus 150. So this is a prepontine epidermoid cyst which has ruptured, and that had led to chemical meningitis. It led to vasospasm. You can see that there is a vasospasm here, and that led to the left MCA infarct in this lady. Well done.
Points okay?
150 to Team Middle East.
Okay. Okay. So this question. This lady developed acute flaccid paralysis after severe sore throat. There were two differential diagnoses when I saw her in Peshawar. One is Guillain-Barré syndrome. The other was diphtheric neuropathy. What was the eye finding that helped me differentiate these two conditions?
In diphtheric neuropathy, the pupils don't respond to light.
Yeah. What do you say? Yeah.
So we have to, that is not a correct answer.
So minus 50. This thing. You want to run the video again? Video?
Okay.
You want to see the video again? So minus 50 to Team Sri Lanka. We can have the buzzer again. Anyone who wants to press 1, 2, and 3. Can explain.
Okay. 1, 2, 3.
No takers.
No takers, huh? So I think again, I apologize for the poor cinematography, but it's supposed to show fairly good reaction to light, but no reaction to accommodation. So this is the inverse Agar-Robertson pupil that is not seen in Guillain-Barré syndrome, but helped us manage this girl with us because there was no way of confirming diphtheria in this particular setting. Thank you.
So we come to the last case of the round. This is the last case of the entire session. So be careful, try to answer. You can score 200 if you want, you can score 100, 150, whatever. Please.
Okay. Say again.
Scores.
Oh,
Okay,
good-
we can
good
have
idea.
scores before the last question. Can we have the scores? Yes. So Team Thailand is leading 450. Team India Thailand 550. Team India 450. Team India Senior 250. Japan 100. Sri Lanka 100. Malaysia -50 and Iran 0. So realistically, the winner can come from Team 6 or Team 7. All right. So
Now I'm tense because it's one
yes.
question.
So we are going to show the question. You can answer even before the question is asked, but you can also score -100 there. Remember. All right.
Okay.
Here we
Maybe
go.
before I run the video, I'll tell you that there are two clinical signs that are apparent in this patient's eyes, and that will clue you into that bag. Okay. I'll repeat in case the audience or the participants were distracted. There are two clinical signs. So look out for the two clinical signs. And then, of course, there's some more information in the text. Okay.
So this is canvas. Canvas gene is RFC2 and repeat is AAA GG. So and
Plus 200.
So the question was, and he gave a complete answer, so there's no issues at all. So the question was, what is the likely genetic diagnosis? The two clinical signs, as you can see, is that, as you know, when you move the head in a conscious patient as opposed to an unconscious patient, there are two sets of responses. One is the vestibular ocular response, and the other one is the pursuit movements, right? So these are redundant systems. Both of them are working. Perhaps we should let the listen to the answers. So there are two redundant systems, the vestibular ocular systems and the pursuit system. So both of them are unfortunately abnormal in this patient. So when you move the head left and right, the only system that's working is the saccades. So all you see is saccadic movements, not smooth movements of the VOR or the pursuit. So this is the absent VOR. And then you can see the saccadic movements because both pursuit and VOR are absent. Thank you.
Thank you. So can we have the final scores? So the winner is Team India. First runner-up is Team Thailand and second runner-up is Team India Senior. Congratulations all the participants and thank you audience for coming in big ways. Thank you.
Thank you very much,
Mr. President.
So now we will no longer be God, so we'll be human
We are
again.
back to humans now.
Back to humans again. Okay. Open to feedback.
Must have enjoyed the session very interestingly. May I request Dr. Gagandeep Singh and Meenakshi Sundaram to kindly come here to give the certification and honor to the winner, please. And I may, this is for the American Academy of Neurology President-elect Richard Stark, that this may be a good exercise as you all are doing for Mind of Tournament in WFN meeting, but maybe in Asia, this may be a new thing.
Well done, guys. Keep it up. Thank you, sir. So you're worried. Well done. Chalo. Well done. Well done. Well done. Well played. Good. Well done. Well done. Well done. Huh? You're the real champs. Huh? Extempo guys coming up together, doing the good job. Good. Keep it up. Keep it up. Thank you. Yeah. Yeah. They're the first runner up. They're first runner up. They're the first runner up. Yep. Yes. Yeah. So well played. Well played. Well played. Thank you. Thanks for coming. Thanks for coming all the way. मजा आ गया ना? Yeah, मजा आया. So well done. Well done. Great. Thank you. Thank you. Keep it up. Keep it up, Team Shringa. We keep meeting. Thank you. Thanks a lot. Thank you. Thank you. Well done. Well done. Thank you. Thank you, ma'am. Thanks a lot. Thank you. Well played. Well played. Thank you. Thanks. Thanks. Thank you. Well played. Yeah. But a very difficult question, pronunciation. You are understanding my pronunciation or too difficult?
Yes.
Okay.
The person was so fast.
Okay. Okay. So well done. Thank you. To finish the award ceremony now. We're done.
Mingzu Jing. Mingzu Jing. Here. David Tang. There must be this. Is David Tang? Yeah, they're coming. No. No, I think this must be the Singapore team. Wait a minute, I will announce something. Sibi Sunning. Here. Dr. Benjamin Tan. Singapore team. Dr. Manjula Caldera. Manjula Caldera. Yeah, please come. Dr. Saman Gunatilake. Please, please, please. Dr. Nurashikul Arifin. Here? No? Oh, yeah. Dr. Benjamin NG. All the best, Benjamin. Dr. Tomoyuki Ishimoto. Dr. Masahiro Ohara. Dr. Mehdi Kiran. Is Dr. Mehdi Kiran here? Okay, this must be Fahima. Yeah, Dr. Fahima Wahabizad. Dr. Pusanu Kanaposi Sud. Dr. Surachit. Dr. Senaka. Senaka Gondusena. Dr. Hanif Khan. Dr. Tae Jian Xiang. Dr. Jim Eder.
Dr. Mickey Uno. Dr. Hormos Harumlu. Dr. Neda Shakinia. Maybe this is the one that was changed. Dr. Totsapol. Coming again. National collaboration. Dr. Katate. Good done. Is everything good? So, those who are last entrant, we cannot give you the certificate here. Like, we are not like Baba, produce and give it to you. These all are planned 1 month before. So, with that note, is there those mementos, please? 2 of them for the first winner and there is a certificate for the winners, please. No, the runner-ups. The runner-up certificate. And the winner certificate, all the 3 certificates, please. CEO of Vidya, I hope. Okay, so first runner-up, no, second runner-up, please come forward. Second runner-up, Team India.
Team India Senior.
First runner-up, Team Malaysia. Thailand. Team Thailand. Thank you, Thailand. Team, come team together. TEAM. The first runner-up gets $750 US. That's to be divided between them. The winners, the last ball 6 scorers. Virat Kohli, come on.
Well done, guys.
Come, hold this up. Hold this too. Hold this.